Hello, I am Dr. Pritesh Junagade. I am a consultant hematologist, oncologist and a bone marrow transplant physician. I am associated with Ashoka CC Hospital as a visiting consultant. So blood cancer can be diagnosed in various ways. As I said, in some cancers, the blood cells, so the abnormal cancer cells are seen in the blood itself. We do a test called complete blood count, also called a CBC, where we can measure the number of white cells. We do a test called peripheral blood smear, where we make a small slide of the blood we take from the patient. We have a look at under the microscope and we can see abnormal white cells. That is the easiest way to diagnose a blood cancer. Sometimes the other way is to do a test called a bone marrow test, wherein the factory which produces the abnormal white cells or the cancer cells, the factory is called bone marrow. And if we go directly into the factory, i.e. if I do a test called bone marrow test, which is done through a needle which is pierced through a specific part of a bone, and we take out the fluid. We see the fluid or make slides of that under a microscope, and then we diagnose basically blood cancer. So in olden days it used to be fine, just to see some white cells, abnormal white cells, cancer cells under the microscope and diagnosing it as leukemia. But today we have got various molecular and special tests. So those tests are called immunophenotyping, wherein we find the exact surname of that abnormal white cell. We make those bone marrow slides and take the fluid part of the bone marrow. We put it in the machine, and the machine counts the number of cells, the abnormal cells, and the various subtypes of leukemia. That's what is important in a test called immunophenotyping. In some patients, we don't get a fluid, so we have to take a small piece of a bone called a trephine biopsy. So trephine biopsy is like a piece of a bone we take out on the marrow. We subject it to various chemical methods and make a slide of it on the third day and do special studies to find the exact surname of that cancer cell. That's called immunohistochemistry, IHC. That result is back in 3 or 4 days. So that's the next way to diagnose a blood cancer. Now, after diagnosing blood cancer, it's not enough. We need to find out why that patient had a blood cancer. So we do special molecular test, and the science has progressed to mind-boggling level where we can find the exact genetic cause of that cancer. The test is called NGS. We subject any tissue like a blood, bone marrow or a solid tissue for this test, and then the results are back within 7 days. So we can pinpoint why this particular patient had a cancer.